Hi guys, my name is Lillian Fozzie, and tonight I will be presenting my case presentation. So I currently am having my field practicum at the PROS program, which is located in Bath, New York, in the Steuben Mental Health Building. The participant that I chose to present is an individual who is a male, 23 years old, and identifies as a Caucasian. This individual has been diagnosed with borderline personality disorder. Some strengths that this participant has is that they are a very honest individual. They're very genuine, down to earth, punctual, very responsible individual, very friendly with other peers and program, engages in therapeutic relationships with peers and staff, is very focused on not only his goals, but just in program as well, focused on group material, asking questions, making sure he understands. And he is engaged in mental health treatment through our facility. He is in the clinic upstairs. And he also has really good memory. There are some challenges that this individual faces, and that is organization, lack of adulting skills, symptoms of anxiety, substance use, both drug use and alcohol use, as well as a lack of socialization skills. Um, some goals and needs for this participant is that they would like to obtain a part-time or full-time position, increase their support system, increase their basic independent living skills to ultimately live on their own in an apartment, and decrease their substance use as well as develop a healthier lifestyle. So, some barriers to treatment and achieving their goals. Even though employers are not supposed to discriminate against mental health, there are employers out there that do unfortunately still discriminate against mental health when individuals are seeking employment. So, this can be something, a barrier that he could face. Um, as well as the co-occurring disorder, which he has expressed assists in his lack of motivation, as when he smokes marijuana or he drinks alcohol, he gets very tired, and will sleep a lot. Um, However, this individual is a Caucasian male, so he will experience less barriers than another individual that may be a different gender or identifies in a different culture or ethnicity. So, some presenting problems are that he has catastrophic thinking, negative self-talk, traumatic past work experience, and even though he has tapered off self-medication, he is still self-medicating. However, tapering off can leave difficulty coping without this crutch that he has used for so long, and will need to learn how to manage his symptoms in positive coping skills. Environmental factors that contribute to the presenting problem is that this individual currently resides with their family members, their mother. So this can contribute a barrier to full independency. So the goal or outcome to be achieved. This individual has made significant progress towards their goal as they have attained employment as of this month. Progress will be measured through monthly progress notes, individual appointments as needed, participation in programming or our educational groups that we offer at our program, our individual recovery plan or our treatment plan, reviewing that, collaborating with other service providers. This individual currently works with an employment specialist in the PROS program, so collaborating with this service provider regarding their progress, as well as assessment concerns, barriers that have been observed throughout individual appointments and service providing, as well as their therapists, since they are connected with our clinic upstairs. Collaboration with the therapist is crucial, as well as developing a SMART goal, which will be beneficial for both the participant as well as me to have a clear path of achievement for the goal identified. So the role of me at the PROS program is that I assist in the identification of goals, barriers, challenges, and strengths. There is an ongoing dynamic assessment process completed while the participant is in the program. So we do treatment plan reviews every 6 months. We do comp assessment, updates, revisions as needed. If there's any significant life role changes, then this would be completed, as well as other assessments such as suicide risks, safety plans, other basic assessments like that. So this individual does have quite the internal resources at this time. He is connected with the clinic. He is attending PROS program. There, he is provided peer support as well as work support from the employment specialist. And currently, this individual now is working and also has volunteer experience and hours at this time. So they are receiving support from their volunteer supervisor as well as their volunteer coworker. And they do have family support from their mother and their sister. One concern that I have at this time is that even with progress of obtaining a job and continuing to attend their scheduled groups, there's a fear of burnout with their current work schedule. So they are working Tuesday through Saturday. And on Tuesdays and Wednesdays, they will work from 4 to 9:30 p.m. And then from Wednesday to Saturday, they work from 2 to 9 p.m. So this work schedule is on top of the PROS schedule where they are scheduled educational groups on Monday morning, Tuesday morning, Wednesday afternoon, and then on Thursday morning. They did have to revise their group schedule on Thursday afternoons due to their new work schedule. So some ideas for further improving the client's condition is to work on developing a healthy routine. So that includes having a healthy sleep schedule, going to sleep at the same time, going to sleep at a appropriate time rather than in the wee hours of the morning, as well as waking up frequently at the same time every day, as well as getting an average of at least the 7 to 8 hours that an average person needs. As well as identifying ways that they can take time for self-care, because with all the different roles that they have going on, being a student and being educated regarding mental health and their diagnosis and recovery, as well as working and being a son and a brother. And so there needs to be time for himself in there somewhere. And then ultimately, time management is going to be a big goal with developing a healthy routine because that ultimately comes down to managing your time effectively and identifying periods of time in your day for certain roles. Um, this practice experience has been a significant and beneficial learning curve for me to be able to put the material that we have learned throughout this program and throughout this past year has been very insightful to see how the different approaches and the different interventions and information that we've learned throughout this time in the program can be used in the treatment process and how different approaches or interventions may have a more significant influence than maybe another one may have. So thank you for listening in and have a good night.